undecideds. He joins us from Capitol Hill. Congressman, thanks for being with us.
Well, it's my pleasure. Thanks for having me.
Congressman, because of your concern about Medicare subsidies, your office had said in recent days you were inclined to vote no. The language in the final bill has addressed some of that. Is it to your satisfaction or not? And how will you vote on Sunday?
Well, the bill, as you know, was finally released yesterday afternoon. It's very, very lengthy, but I spent a good deal of the night and early morning with my staff going through the bill. And I have always been in favor of health care reform. I think it's something the country needs. I think it's something we need to do. My question was, how is my state and how are people that need the help treated? In the House bill that we passed, it was fair and equitable. The Senate bill was not. And when the president said he was going to use the base Senate bill for his combined bills, I was very, very nervous, both in terms of payments that my state of New York gets, dish payments for the hospitals that need to help indigent people, and also for what's called the do-gooder states. New York was penalized under the Senate bill because we have done the right thing and provided health care for our people, and the states that did not were given a windfall, and I didn't think that was fair. Well, upon reviewing the bill, I am satisfied that the bill has moved a great deal towards the House bill in terms of compensating my state and doing the right thing for health care. So I determined this morning, and this is the first time I'm announcing it, that I will vote for the bill. I think that health care reform in this country is important. If somebody loses their job or changes jobs, they need to keep their health insurance. People should not be denied health coverage because the insurance companies say they have a so-called pre-existing condition, nor should they be denied health coverage with these artificial annual caps or lifetime caps where you pay your premium year in and year out, and when you get sick you're told sorry, you're not covered. So I think that this bill takes care of all that. I think it's fair and equitable to my state.
Well,
and I
Congressman, I think I can hear the chairs over in the Speaker's office and also down at the White House now that you've made it clear. Are there other members of Congress that share your concerns that you think will that you'll be talking with today as you explain your decision to vote for this, that you think will also follow the same path?
Well, I do, and I also think there are people coming at it from the opposite point of view, where they are very concerned about cost. And I think, again, even there, the Congressional Budget Office scored the bill and said that ultimately the bill will save a lot of money. It'll bend the health care cost curve. And so I think from that point of view, there are going to be some members coming over. And I agree with what was just said on your show, that when it gets this close, and the leadership, Nancy Pelosi, Steny Hoyer, they put their prestige on the line. I think it would be disastrous if the bill was not passed. Disastrous for the country, because I think the country needs health care reform. And my whole reason for it was that we now have 45 or 47 million Americans uninsured, but the current system's not sustainable, and we will wind up having 60, 80, and 100 million uninsured if we sit back and do nothing. So while this is not a perfect bill, I'm sorry, this is not a perfect bill. It goes a long way to doing what we need to do.
Congressman Eliot Engel announcing just on our air right now, you heard it there, that he will vote for the bill. He is no longer undecided. Congressman, thank you so much for breaking the news with us. We appreciate you coming on this morning. And again, put another one in the column of the Democrats passing this bill. Eliot Engel moves from undecided. He will vote for this bill. Congressman, thanks for joining us.
Thanks for having me, David.
You're welcome. As the vote gets